I got 2 minutes yet.
You want to turn your microphones back on?
I think definitely goes. Good evening, everyone. Thank you for listening tonight. Thank you for taking the time. I would like to share with you the purpose of what we're here and why. Originally, there had been some discussion about the city having a special meeting, but I look back and what we did right after the earthquake, and we had a town hall meeting with over 500 people. Well, knowing what's happening in our community right now, we can't have a town hall meeting. So what we're doing is a virtual town hall meeting. And we have asked people to email their questions to us. We have all those, and as you can see, we have 12 callers in queue. What I'm going to do is introduce myself, introduce the 4 of us up here, and then I'm going to ask people to come up and speak in an order that we have designated. They will speak for 3 to 5 minutes. Some of them have to leave early, and so the questions that you have emailed to them will have been answered in their time to speak. I appreciate the fact that you cared enough to tune in, that we have opportunities that we've never had, circumstances we've never had, and problems that we're going to deal with, and we're going to share with you tonight how we are doing that. So as the speakers, the panel members that are here in front of us, all separated by 6 feet, will come up to speak to the podium, I will ask you to keep your questions until they speak their 3 to 5 minutes. We will ask each of the speakers to speak their 3 to 5 minutes, and then we will go to the callers in queue and the emailed calls. My name is Peggy Breeden. I'm Mayor of the City of Ridgecrest.
Lindsay Stevens, Mayor Pro Tem.
Ron Strand, City Manager.
Jed McLaughlin, Chief of Police.
Okay, thank you all. We appreciate it. There's a couple of things I would like to tell you. Shannon Grove was to be online, but they are still in session, and so she is unable to attend. She sends her regrets and wants us to know that she's doing the job that you all elected her to do. So we are very appreciative of the fact that they came to speak and that they came to hear and that you did, and I've said this over and over again, and I'll probably say it 10 times tonight because there's no reason for us to do this without you. So I thank you. So our first speaker is from Ridgecrest Regional Hospital, and if you would come up and introduce yourself, sir, to the podium.
Madam Mayor, really quick, just to make sure those who are watching online that you're muted for a reason, so just hang on. When we get to the calls in queue, we'll bring in one at a time. So just be patient.
Thank you, Madam Mayor. My name is Jim Suber. I'm the CEO at Ridgecrest Regional Hospital. And thank you for inviting me tonight. I want to assure our community that RRH is ready and being proactive about how to continue to provide patient care in our community. Your hospital is still open, and we intend to remain open and provide care. Our hospital continues to prepare for a surge of patients if it comes down to that. We hope it doesn't, and that's why all of us must work together to slow the spread of the coronavirus by everyone taking preventive actions. Any hospital in the United States is going to have challenges with a large increase of patients all at the same time, and that's why slowing the spread of the virus is so important. The hospital does practice emergency preparedness throughout the year in conjunction with several local agencies and following various protocols. Right now, we are in constant communication with government agencies, such as the Kern County Public Health Department and the state of California, which provides us with the most current direction and updates. Our hospital staff has been incredible working through this. Elective cases, exams, and procedures are still going on at the hospital at this time if both the physician and the patient agree. We will modify this as circumstances change or the direction from government agencies, but as of now, we are still continuing to do elective procedures if the physician and patient agree. Since there is a recommendation that those 65 years and older stay home, our personal care services and visiting nurse services and homemakers are still continuing to provide at-home care to our seniors that are under our service. I'm not really allowed to discuss testing numbers and results under a county health department order. However, based on my last check, there are no positive cases in Kern County as of this moment. It is critical that testing be reserved for the most likely patients so that the outside reference labs can keep up with the volume and that our hospital does not run out of testing kits. It is important that we let our licensed providers, doctors, nurse practitioners, physician assistants determine the most appropriate test for each patient in sync with the current recommendations from the government. The present turnaround time for a coronavirus test is 2 to 4 days, but I just received word that due to a backlog of testing required, it could be now from 4 to 5 days. The hospital has 4 ICU beds, which can be expanded to 8 beds and then expanded to 16 beds if needed and with state approval. All these rooms are equipped with breathing equipment such as ventilators. At the time that we do have a critical volume, and if it occurs, we will consolidate our outpatient clinics and physicians to the emergency department and other locations as deemed important to concentrate our medical resources. Our medical supply level is susceptible. We did receive additional supplies from the Kern County Supply. However, I need to tell you that N95 masks are in very, very short supply, even for us. We need to protect our doctors and clinical staff, and the masks are key to that. Please remember that only an N95 mask can protect you against the coronavirus. Normal surgical masks will not provide that protection, but we must leave as many N95 masks as we can so our doctors and nurses can continue to provide care. The biggest constraint our hospital have will be staffing, which is why it's important to protect our staff. The community can help by calling ahead if they have coronavirus symptoms or other things that they think may be contagious so we can plan for their arrival. We are actually offering daycare for our employees to ensure that we have enough staff at the hospital, and our staff are doing a great job through this crisis. If we need to, we will add various triaging locations at the hospital to identify high-risk patients. We are working on a drive-through system so that patients can be checked in their car and then get on their way after being examined and any testing samples acquired. We hope to have that operational by Friday at the latest, as we are seeking state approval. The hospital is also ordering some recently developed lab equipment to assist with the rapid diagnosis of respiratory issues related to the coronavirus, and we're hoping that that will be in the next 2 to 3 weeks. Our goal is to mitigate the risk of community spreading of the virus and avoid having a local crisis and a surge of patients. Slowing the spread of the virus down may result in us having time to develop a vaccine and more rapid testing procedures. It is critical that we slow down the spread of this virus to give our scientists nationwide time to come up with ways to prevent it from spreading even further. So just a couple of reminders. Social distancing for residents of all ages, not just people 65 plus. It includes our young people as well. Please follow the directives from the President of the United States and the Governor of California to minimize contact and stay at home whenever possible. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, sneezing, or having been in a public place. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick and stay away from large gathering and crowds. If you're at high risk, stay at home as much as possible. Consider ways of getting food brought to your house through family, social, and commercial networks. A question we did get: if you are evaluated but you do not fit the criteria to be tested for COVID-19, should you report to work? This is a bit of a tricky question because you don't meet the criteria for the coronavirus, but you are positive for flu, which can have equally as horrible spreading for your coworkers. The right answer, we think at this time, is if you have concerns about going to work, regardless if it's the flu or the coronavirus, you should have that with your discussion with your provider at the time of your visit. Again, if you think you have symptoms and need to come to the hospital, please call us prior to your arrival so we make arrangements to treat you safely, which is probably outside so that we can isolate people from our other staff and other patients. Please remember that, in my opinion, this is not a question of if the community will have incidents of the coronavirus. It is a question of when. We can minimize the impact by following these precautions until there's more rapid testing, a better understanding of a virus, and a potential vaccine is developed. Thank you very much.
Thank you, Mr. Suver. I want to say for the public that Mr. Suver tried to answer all your questions that came in on email. Because of the seriousness of where he's got to go back to the hospital, we want him to be able to leave, and we thank him for his participation. Okay, the next person we have is going to be Assemblyman Vince Fong was going to be here, but he has a representative, Lauren Skidmore. And Lauren, she is not here, you can see it, but you will be able to hear her. So Lauren, would you please begin your address?
Yes, good evening. Can you hear me, Peggy?
Thank you.
Yes, we can hear you.
Great. Ridgecrest residents, the assembly member would like to send his apologies for not being able to chime in. He is in legislative session and has been for most of the day. In Sacramento, things are changing rapidly. Currently, the legislature is voting on numerous budget spending bills, numerous bills that will help assist and aid our local communities in regards to the coronavirus. He wanted to share with me that he is available and our office is available during this time of adversity. Your community is not unknown to this type of challenge, and we know you will be able to take this head on. We encourage your community to take precautions. As Mr. Suver mentioned, we are behind him 100% in all of his efforts, and we will be supportive of anything that the hospital needs, that your community needs. And we are here to be a liaison between any of your major industries, your hospital, your medical community, your schools, and any state agency or department that you need answers from. We want to provide information to local businesses if you're feeling concerned about the current environment. If you're in need of small business loans and or grants, there are opportunities out there because both the federal government and the state government have released a lot of barriers. Our office is here to help. We are here to guide you through this and provide you as much information as possible. Our website and our email address is available and open to anyone. So please email us with any question that you may have. We have the ability to reach out to individual state departments to get the answers you need. And I'd like to wrap up and say that our Kern County Public Health Department has been, bar none, prime top example of how to handle the situation. They are providing daily updates. Their website is where we're sending most of our folks to. We're getting briefings from California Office of Emergency Services, but public health is always a step ahead in providing the information, so please look to them for up-to-date information. And again, we know Ridgecrest can handle this. We're not surprised that you all are being proactive in having this virtual town hall, so I congratulate the mayor and the mayor pro tem for your effort and for your community in getting up and running. So thank you.
Thank you, Lauren. Are you still going to be online, so if questions come in, you'll be able to take them?
Absolutely.
Okay, thank you. All right, the next group of people we're going to go to is the Navy, and if you would come up and introduce yourselves, please, as in whatever order you would like to.
Good evening, Captain Paul Dale, the Commanding Officer of Naval Air Weapons Station Charlie Lake. I'm joined by the Prospective Executive Officer, Commander Simon, the Command Senior Chief Montanero, and we have our Judge Advocate General, Lieutenant DeMeo, and then our Public Affairs Officer, Margot Allen. I have no remarks. I'm going to defer those to the queue since it's getting larger and larger and we get to the questions. So thanks you for inviting us, and we look forward to the questions.
Okay, thank you, sir. All right, the next person to speak is our Supervisor Mick Gleason. Mick, would you begin?
Mayor, can you hear me?
You're here. We hear you fine.
Thank you, Mayor. Appreciate it. Great idea, Mayor. Thank you for inviting me, and thank you for letting me take a moment to participate. Today, Kern County's Chief Administrative Officer declared a state of local emergency. He did it with following the lead of the nation, declared a national emergency, the state said a state emergency. Our Chief Admin Officer declared a local emergency. Tomorrow, we will be discussing this local emergency in board session, which is why I'm down here in Bakersfield tonight. The purpose of his declaration of local emergency, which we will ratify tomorrow, is an effort to protect our residents, protect our workforce, and to help with our economy. Essentially what it means, being in a local emergency, is that our department heads have been briefed, and if ratified by the Board of Supervisors tomorrow, they will reduce their staffing to essential members only. And they will remain that way until April 14th. Non-essential members can stay home, remain available, and as always, they remain responsive to any disaster relief decisions that we need to make. All county employees are sworn disaster relief agents. All employees will remain paid. This will be paid. The essentials will be working on their staffing plans and doing the essential work. Non-essentials can stay home, work from home if able, and remain available. Buildings, county buildings, will be closed until April 14th. Many county buildings, not all of them, and I'm filtering through now to find out exactly what that means to the Ridgecrest area. But the full list will be made available on our website, which is kerncounty.com. I appreciate what Assemblyman Fong's representative said about our public health department. They're fully engaged, and they're as engaged as they possibly can be, working on the testing as best we can to move things along. I'm available. I'll remain available, Peggy, for any questions that we have. Thank you very much for your time.
Thank you, Supervisor. The next speaker is from Sierra Sands Unified School District, and if he would come up and introduce himself and begin his talk. Thank you.
Sure. Thank you, Mayor Breeden, council, and staff. There are about 1,000 school districts in the state of California, most of which at this point have now been closed. Sierra Sands Unified School District will be closed for students tomorrow, Tuesday, March 17, through April 14. It's an incredibly complex issue for us, and we're working it through, but I'll keep my remarks brief and then defer to questions. Our main focus is on serving students even during this time of school closure. We have set up curbside grab-and-go opportunities at no cost, Monday through Friday. Students actually from the age of 1 to 18 can get free meals at Fowler Elementary School, Pierce Elementary School, Monroe Middle School, and Inyo Kern Elementary School. And there are 2 windows of time for breakfast between the time of 8 a.m. and 9:30 a.m., and for lunch between the time of 11 a.m. and 1 p.m. So we encourage people to take advantage of that resource and opportunity for nourishment. We are also conducting a device and internet survey to all of our 5,200 students and their parents to determine the level of technology access, and then making sure that we provide both devices and creative ways of getting online opportunity, because one of the priorities of the governor, which we will be executing, is the continuity of learning and making sure that whether it be through paper packets or online, it will probably be a hybrid. It will be probably a blend of paper packet learning and the use of online courseware. And And then, of course, just making sure that we're good stewards in providing the opportunity to suppress and slow down any spread of risk. So at this time, I will conclude my remarks, and I'll be awaiting questions. Thank you.
Thank you, sir. Thank you, sir. The next speaker we have is from Saracosa Community College. Would you please come up and identify yourself, please?
Hi, my name is Corey Marvin. I'm the Vice President of Instruction at Saracosa. And I wanted to say very similar to what Dr. Ostash said. We have community colleges all over the state are closing in a variety of different ways. And we are moving instruction online as of next Monday, March 23rd. All courses that can move instruction online that is happening. We are closed in terms of instruction for this entire week while we get faculty and students trained. Of course, we have a very large online program, so this is very familiar territory for us. But we still have some students and some faculty who prefer the on-ground courses. They also will be asked to move online. We will be continuing at this time with the instruction that cannot go online, such as science laboratories and CTE, career technical education, hands-on type activities in the courses. Aside from that, we've followed the California Department of Public Health guidelines in canceling all group gatherings up at the college through the end of March, and athletics has been canceled for the spring semester. I do want to emphasize that while on-ground instruction is closed this week and moving mostly into the online environment, except for the classes that I mentioned, student support services and learning support services, that would be counseling, advising, financial aid, admissions and records, library tutoring, and proctoring, are all continuing to go on as of this moment. So with that, I'll conclude my remarks and be ready for any questions that might come up. Thank you.
Thank you, sir. The next speaker is from the Ridgecrest Chamber of Commerce. If you would come up and identify yourself, sir.
My name is Tim Smith. I'm the Executive Director at the Chamber of Commerce here in Ridgecrest. One of the things that we talked about was the need in this time when we are isolating to still support our local businesses. We see this as an opportunity to crash and burn or come together and strengthen and sustain each other. One of the things that we talk about at the Chamber is the need to build community and to strengthen the economy. And while we have to practice social distancing, it doesn't mean that we have to seclude ourselves from our local businesses that are our neighbors and our friends. And so we want to reiterate to our community and to one another that we still have to go to the grocery store. We still have to get our supplies as much as possible. Do it still in Ridgecrest. Amazon is super easy, but Ridgecrest pretty much has what you need. If we're patient, if we don't hoard, if we don't go and get everything all at once, we continually have what we need, and so we'll be able to still see that. As far as the Chamber, we have a number of things going on in the city across the board of events and things, and as those get shuttered, and the questions are coming up of how many times can we meet or who's going where or whatnot, the Chamber has cut back on what we're providing. And if you go to our website, we have a list now on our front page that lists everything that our businesses and our community could need, going from the CDC website all the way down, linking to the hospital and to our colleges and our school district, so that there's easy access to get some of the information, as well as the things like going on to the, I'm going to look it up because I didn't know this website very well before today, the EDD, the California Employment Development Department, and some of the work that they're already putting out. So we have links right there for our small businesses who are worried about what's going to be taking place. So we are trying to get the word out and to continue to reiterate that even in this time of isolation, that we are still a strong community and we need each other, and our small businesses need us. I think that's all I have for today.
And will you be able to stay and take questions?
Yes, ma'am.
Thank you very much. Okay, the next entity is the City of Ridgecrest. I'm going to ask the three up here to speak briefly.
Yeah, I can cover just a couple of things really quick because I know we have a significant number of callers in queue. The most important thing that's affecting the city is that we've closed the Kerr-McGee Center, all of the youth sports programs, the rental of the facility until March 14th. We've also, effective Wednesday, we'll be closing our preschool. We'll also be offering student daycare for our city employees so the critical employees can stay working. Throughout the rest of the facilities, we've restricted folks that are symptomatic of flu symptoms from entering the building. So right now we're monitoring the state and county and national information on the COVID-19 virus. We're keeping our city staff up to date as well as our council. And so as things progress, we will continue to move forward. One of these is also this virtual town hall meeting. We do plan on having this in the future as a method to keep the community up to date. So that's all I have at this moment and waiting questions.
Thank you. Lindsay?
Okay. I just wanted to make a few remarks. I just wanted to say that after this July, we really are kind of at more of an advantage than other communities. We went through the earthquake and we've come through the other side. We really banded together as a community, and we just need to remember to be calm. Water's still going to be coming out of our tap, so we don't need to be hoarding water. We need to be kind and courteous to each other, and we need to be a good neighbor, especially to our elderly and disabled. We need to be checking on them daily, see if they need help with food or meals or any medical supplies, and that's all I had to say.
Thank you. Chief? Okay. Chief is going to have other things to say as we go along. So now we're going to start out with the callers in queue, and then we will do the email ones. So can you address us to the first caller who's in queue, please? Caller, are you ready to talk?
Please state your name.
Is he or she connected? Yes? Okay, caller, we don't hear anything from you, and so we're going to skip you and go to the second one. The second caller, please identify yourself and ask your question and who you'd like to direct it to. Are they able to hear us? Yes.
Do they know that they're the caller up in queue?
There's
callers have been sitting in the queue because if I put them in the lobby, they disconnect because they don't hear anything. So everybody hears it right now.
all right. Caller number 3.
So everybody would be.
Does any caller have a question? That's what we need to be asking.
Well, we don't want them. We want them in the order they called in. We will go back to those that we've skipped. So can you hook them back in? Okay, caller number 3. Caller, is there okay. Is there a person who is live who can hear me even if we're not in the order you were told you would be? Are they able to hear us?
I don't know if I'm live. But
yes.
There we go.
Please
go ahead.
Introduce yourself.
Go ahead and speak, caller. Identify yourself.
Okay, my name is Rick Martin, and I didn't realize that I was live. That may be the problem with other callers in as well. I had emailed a question regarding the number of tests that have been conducted in Ridgecrest. Curious if you had an idea of number.
Yeah, I believe Mr. Suber stated at this point in time, due to Kern County public health officials, he's unable to state how many tests that they've actually given or provided.
Thank you.
Okay, the next caller, please identify yourself. Callers, please remember, if your calls are directed to the Ridgecrest Hospital or Mr. Suver, he tried to answer as many as he could and he had to leave. So if you are waiting for a question to be answered from Mr. Suver, he is not able to answer those. So the next caller in line, please speak. Were they given numbers, please?
I have someone who messaged me their question because they couldn't. So I have someone wanting to know if the recorder's office is going to stay open because for builders and real estate, that's going to be important.
Mick, can you address that?
Yes, they're essential personnel. They will remain open, and that is an essential service. So yes.
Thank you.
Okay, is there another caller? Please identify yourself. Okay, if you don't think you're in line, please just somebody speak up. Did all 23 of you hang up? Okay.
Hello?
Hello, please speak. Could you ask your children to be still for a moment because we're hearing them more than you? So please speak up and identify yourself.
Hello, can you hear me?
Yes. Please go ahead.
Yeah.
Hello, I have a question regarding the employees at Pearson Schools.
Could you, wait a minute, could you identify yourself, please?
My name is Nancy Hernandez.
Okay, and now ask your question. It's to Mr. Ostash.
Yes, I'm concerned about the employees at the Pearson school districts. I hear that we won't have any students there, of course, and a lot of the teachers will not be there as well. What about the full-time paraprofessionals that were not released from school duties? What will they be responsible for, and why is it mandatory that they go to work?
Go ahead.
So all employees, yes? Okay. So all employees in Sierra Sands are reporting for work tomorrow. There is a little bit of flexibility for teachers. Some teachers are able to deliver their curriculum depending on what grade they're in or what level through technology, and so there's some flexibility. We're going to be, it's much more complex for classified employees. The classified employees, for those who are listening, are all of those support employees. That includes food service workers, bus drivers, paraprofessionals, clerical staff, etc., maintenance and operations. I could go on and on. And we are waiting for some guidance from the governor's office tomorrow morning. We're being promised that the governor's office will provide some written interpretation of what kind of flexibility we can implement for our classified workforce. We do fully anticipate. Some people are calling it essential and non-essential. We're thinking maybe more of requisite versus regular employees. We think maybe some people may not like the term not essential, and we don't want anyone thinking they're not any bit as important as everyone else. But we are anticipating for the entire workforce, including our classified workforce, that as we move through this issue, that there will be flexibility. Here's our main focus: making sure that nobody loses pay. That's one of the governor's focus, that they continue to get paid. And to the extent that we can be flexible and allow employees to take care of their families and to help not spread the disease, we will do that. So one of the things I'm doing is communicating regularly with my employees and parents, and there will be lots of additional communication for all of our classified employees tomorrow.
Okay, thank you. Your question was answered, correct? Okay, we'll go to the next person. Please speak up, identify yourself, and direct your call to whomever you wish. Somebody speak up.
Jed has one.
Okay, go ahead, Jed.
This would be for you, Dr. Marvin. This email question is regarding a person who has a child in the daycare center at Saracoso who suffers from a medical condition. The child has been there for 3 years and is wondering, due to having to pull them out, if they will be able to retain their spot at the daycare center.
Or was that? I can't answer that question directly, but I can say that for sure the Child Development Center is open, continues to be open, and continues to work and operate under the same processes and protocols that it has been operating under. So to the extent that there is a question about that, I urge the caller to contact the Child Development Center and follow through with those questions.
Okay, thank you, sir. Is there another caller online? We're trying to get to you first before we go to the email ones. Any other callers online, please identify yourself and speak up. Did I hear someone, please?
Can you guys hear me?
Please identify yourself. Yes, we hear you fine.
Okay, my name is Robert Znieski. I have a question for Mr. Ostash. My daughter is currently in credit recovery for a class that she didn't pass at Burroughs, and I'd like to know what was going on for that.
What, Robert, can you say your last name again so I can take notes?
Znieski.
Okay. So I can say this. All of our student programs are closed as of right now. So whether it's credit recovery, whether it's comprehensive school, whether it's a continuation school like at Mesquite, all of our programs are shuttered. However, we are looking to continue some kind of alternative opportunity for everyone. So what I will do is, and I don't know what that looks like yet for all of our classes. We actually had a management team meeting today at 4 o'clock today, from about 4 to 6, and I know that we're working just as quickly as we can. But I can assure you that for credit recovery, it's just like the other programs. Even though the school is shut down, we will be looking to do distance learning, and it will either be paper packets for your daughter, or it will be, I can't remember if you said daughter or son, paper packets and or some online instruction. And I will make sure that somebody's in touch with you. If you would care to, you could call either, because the offices will be open at our school, so you can call either Mesquite High School or Burroughs High School to get specific information. So we will continue to work with your students so that they don't fall behind.
Thank you, sir.
Yeah.
Okay.
Thank you.
Thank you. The next caller? Are there any other callers waiting online?
Supervisor Gleason, can I check in for a real quick second?
Please identify yourself and direct your question.
Hello, can you hear me?
Yes. We hear you fine.
Hello?
Yes, we hear you fine.
Okay. Yeah. My name is Niket Kumar. I am a small business owner. I own a hotel in town. We have a lot of cancellations and our occupancy has declined drastically with the coronavirus. But we still have to pay our bills and mortgages and utility bills, and it looks like it's going to get really tough for us in future. So, is there a way city could help us if we get into that situation?
Are you seeking information? Is that what you're thinking, or what kind of help are you looking for, sir?
if we get into a situation where we are not able to pay our bills,
Okay.
because we still have to pay our bills even if we don't get business,
I'm going to direct you to the Ridgecrest Chamber of Commerce. Please, sir, Tim.
So I saw today that the Small Business Administration is putting out information regarding that. And it's coming through to California, and Cal Chambers, which is an organization that our chamber is a part of on a larger scale, is gathering that information and will be distributing it down to us so that we can more efficiently share that with our members and with our community. So I know the SBA, and that was part of, I believe, the large amount of money, billions of dollars that the president set aside was for small business issues just like this. So it's something that is still being fleshed out of how it'll be played out, but they are addressing it as we speak, and the information will be available, and I will put a link for more information on the chamber website tomorrow.
And also, most of the utilities companies have adopted a policy that they won't be shutting off utilities for non-payment. So.
I know there was a limit on the time frame. Yeah, they would not do it forever. So, okay, thank you, Tim. Next caller, please identify yourself and speak up.
Hello?
Go ahead, identify yourself and speak. We hear you fine.
I am Dawn Scher. I am a parent, and I have children at home. Full-time babysitting is not an option I have. What can I do?
What is not an option you were saying?
Care for my kids. I have multiple kids in school.
We're gonna direct you to Dr. Ostash.
Yeah, that's a very fair question. So Kern County has 47 school districts in it, and as a county, we were, I will say, we were one of the later counties and districts to make the assertive decision to close school. And I don't know, I'm not going to say why that happened, because there's lots of different reasons, but I can tell you one of the main ones was our our understanding of its severe impact on our community, and that many of our parents all of our parents rely on us as a service to educate their children, but for many of our parents, it's a part of their lifestyle, and they really rely upon us. And so I want to say to you, the caller, and everyone else, this has been an incredibly difficult and painful decision. And I will say one of the governor's 4 priorities is for school districts to find a way to provide some supervision or some child care. And that's one of the 4 priorities that we have not yet figured out, and we're going to be working on that tomorrow. We are working on it, but we're working on it tomorrow to develop and implement a plan. Of the 4 priorities, that is the most difficult one for us to determine. There are many reasons why. You can imagine one of them is that in order to provide supervision and child care, you need workers to do that. And so you're trying to manage what a shutdown means for protecting all people, including your employees, and keeping social distancing. So we're working on that. So to the caller, we're developing a plan to determine some level of supervision or child care, and stay tuned for that information tomorrow and the next day. And we're hopeful that we can find a solution that works for your family and for the hundreds and hundreds of other families out there that are in the same situation as you. And I'm so deeply sorry. It's a severe impact for all of our communities across the country to not have their public education systems firing on all cylinders. Very regrettable.
Okay, thank you. The next caller, please identify yourself and speak up.
Hello?
Go ahead. Please identify yourself and ask your question.
What? No,
Hello?
it's the town hall meeting.
Can you hear me? Caller,
I can hear you.
can you hear me?
I also hear
Please.
children. This is Lori Action.
Okay.
My question actually is for Dave, and we don't know what
order we're in. That's why you're hearing us say hello. So my question is this. I know that we're doing everything possible with the schools and the virtual and the home packets and all that, but what I haven't heard is because we're shut down for basically a month, is that going to be tacked on to the end of the year? In other words, school's scheduled to be out May 28th. Are we looking at June 25th or 19th to be out of school? Is it going to extend out, and then does that keep our date the same for school beginning in August?
That's an excellent question. As of right now, it's my understanding that that the governor is going to apprise us tomorrow with specific guidance about that. I will tell you this. I fully anticipate that there will be resolutions passed that grant exemption for those school districts who have to take off several weeks. And like I said, just about every one of the 1,000 school districts are in that boat. So I fully anticipate that we will not have to alter our calendar other than the current alteration, which is we're not in school. So I fully anticipate that our date of graduation will remain the same, that our final day of instruction will remain the same. I can't promise you everything because I don't know what the future holds. For example, hypothetically, if school districts go beyond, like currently we're scheduled to come back to school Tuesday, April 14. If there is further information that comes down the road that requires school districts to be out longer, I have no idea what that impact could be if that were to happen. But as of right now, I fully anticipate that the legal exemptions will allow our school district and all the other school districts to end at the time that end day that we have established in our current calendar.
Okay, thank you.
Okay, thank you very much.
You're welcome. Callers, I'm asking if you've already heard the answer to your question, please don't stay in queue. But if you haven't, please continue. So the next person, please speak up, identify yourself. Caller, can you hear me? Caller? Caller, please quiet your children so we can hear you. Caller, please speak. Caller, one more time.
She's been struggling with this.
Caller, please speak. Identify yourself.
Supposed to be in the queue, and I guess they're not in the queue.
Yes, you are in the queue. We are listening to you speak. Please speak now. Caller, please quiet your children so we can hear you. Caller. Caller, we're going to have to cut you off and go to the next call if you don't speak. Caller, last chance. Okay, go to the next caller, please. Next caller. Please speak up. Okay. The next caller, please speak up and identify yourself. Caller?
Anyone with a question, please ask your question.
Okay, Jed, go ahead.
This is from Danielle Mao. This is a three-part question. Will you be taking as drastic steps as Los Angeles, closing eat-in restaurants, gyms, bars, etc., and are public parks still open?
Currently, we're following the governor's directive at this point in time. So right now, it's optional for bars to close at this point in time, but highly recommended. Our city parks are open right now. There are public lands. We do have staff that is cleaning the play equipment every day. In the morning, we're spraying it with bleach and spraying it off. So we're doing the best we can to keep the equipment clean.
Okay. The next caller. Please speak up, identify yourself, and if you have children, please quiet them.
Yeah. Oh, I wonder why.
Please speak up. Caller?
Can she hear me?
Caller, we're talking to you. We're hearing you. Please speak up and identify yourself.
Hi. Well, I think that
Please go ahead and speak, caller.
When hotels are going to be open, I've had some family that was supposed to be coming into town, and I was wondering if the hotels are still going to be accepting people.
Did anybody understand that?
I'm sorry,
call?
sir. What did you say about the hotel?
I was just wondering if hotels would still be accepting people in Ridgecrest.
Would hotels still be accepting people to stay in Ridgecrest? As far as we know, we heard a gentleman earlier that sounded like he was more than willing for customers to come in to help pay his bill, keep paying his bills. So as far as we know, the hotels remain open. Are you asking because
Yes,
of the
they-
governor's question of being able to commandeer hotels for health care? Is that your concern?
Yeah.
Okay. At this time, we
And,
don't have to shut down our hotels for operation.
Okay.
All right.
Okay.
Please, callers, please, quiet your children so we can hear you. The next caller in line, please speak. Caller, please speak, identify yourself. Caller, please speak, identify yourself.
Peggy, this is Patsy Smith.
Okay, what is your question?
I just have a suggestion. With the thing the governor's put out about social distancing and that sort of thing, have the stores here thought about maybe allowing only so many people in at a time? Because right now, if you go in a store, it's mass people in there, and there is no social distancing.
I have to tell you, I went to see the two Albertsons and the Stater Brothers on Thursday. They were doing the very best they could. They had all their registers open, and the fact that so many of you were going at the same time because you were all working that particular day. I know that their staffs are overwhelmed and they're doing the very best they can. Nobody wants to anger anybody. They just want to take care of the customers they have, and they're doing the very best. I did ask one of them. Pardon me?
I said I totally agree. They're doing a great job, and I personally haven't been in the masses, but I know people that have been, and there's no way with allowing so many people in there that you can be socially distant from anyone.
I did ask them if they were going to consider ways to do that because they are bound by the governor's same statements that everyone else is, keep the social distance, and I asked about whether seniors could come in early. They are looking at that, so the seniors don't have to stand in line quite so long. But that is not an issue. We can tell them how they must operate except what the governor has said.
Right. Okay, thanks, Becky.
Thank you. Okay, the next caller, please identify yourself. Caller, please ask your children. Yes, please go ahead and speak and identify yourself.
My name is Samara Leonard. I'm one of the residents here, and I have a question. Are the stores going to do anything about large quantities of certain people taking it out? Are they going to be having limits on it?
Yes, the stores have notices on their doors that they're limiting quantities on some of those things, and we cannot tell them at this point in time how they can sell them or what they can do. They are their own independent business. Clearly, they want to take care of all of their customers, and they're doing the very best.
Okay.
Okay, thank you. Next caller. Caller, please identify yourself. Caller, can you hear me? Jed, do you have another question?
I have one too. I have one. It's for Captain Dale. Someone wanted to know about if the base plans on closing anytime in the near future.
Wait a minute, please. We have a question.
Hold on.
I have to push something?
No, I had to push something.
Oh, okay. So the question is the base going to close anytime soon? To be determined. Not my decision. Thank you.
Okay, next caller. I hear you. Please speak up and identify yourself. Next caller, please.
It's going too close.
Please.
To be determined about that.
Please identify yourself. Caller, please identify yourself. Caller, identify yourself. We're going to give you one more chance. Please identify yourself and ask your question. Caller, we can hear you. Can you hear us? Okay, we're going to skip this caller and go to the next one.
It's an open line. So if anyone has a question, please go ahead and state your name and ask your question.
They have them in queue.
He took them out of queue.
Okay. All right. Someone speak up, please. Is there anyone who wishes to ask a question, whether you think you're in line or not?
Are you guys doing okay?
Please speak. Please speak and identify yourself.
Jed has one.
All right, we're going to skip this one, go to the next one. Jed, would you ask your question?
Sure. This is from Rebecca Vance. She's asking, what about those of us in Inyokern? We're in the county area, and we do most of our stuff in Ridgecrest. I work in Ridgecrest, but everyone keeps telling us they are on their own. We are pretty much an extension of Ridgecrest, so it would be nice to feel included. So tell us if this includes us or if we're left to fend for ourselves.
Supervisor Gleason, can you take that call?
Thank you, Mayor. Appreciate it. I appreciate the question. Good question. There's no difference between someone living in Inyokern and someone living in Ridgecrest. This is all of us. We're in this together. There's no difference. Anybody in Inyokern is available, has access to the same services that anybody in Ridgecrest does. So there should be no questions at all about the service that's being provided in Inyokern.
Okay.
Thank you.
Thank you. All right. Is there any other caller that would like to speak up, whether you think you're up next or not? According to our information, there's 16 of you waiting to call. Please speak up, somebody.
They may just want to listen.
Okay, we're going to go ahead then and go to the rest of the questions if there isn't anybody else in queue who wants to speak. Please.
Ready?
Okay, Jed, we're going to cut them all off then. The calls in queue are gone because no one has spoken. Pardon me, is there somebody there? Please, caller, if you're listening, speak up. Caller? Okay, let's go to Jed.
All right. Will our city government put in place requirements to halt large gatherings of people in the community, including activities, churches, meetings, etc.? That's the first part of the question. This is from Leslie O'Neill. Question 2, does the city have a plan to ensure supplies and goods will continue to be available? And question 3, are there plans to deliver goods to the infirm / those unable to get them?
Yeah, I think the first question is we will follow what the governor's office puts out about the number of people that should be meeting. Right now, I think the last CDC recommendation was no more than 50 people gathered in any one event. Well, the president came out with 10 for the social gathering. That's just a new one. So We will attempt to abide by this. None of these are direct orders. In other words, you're not violating the law if you don't follow them. However, we strongly recommend that you follow the advice from both the White House, the state, and local authorities.
As far as the cities trying to ensure that the delivery to the stores are done, there is nothing I'm sorry. As far as the cities addressing whether stores get their deliveries or not, all we can do is give them the best roads that we can give them, the best service we can give them. We can't guarantee what they're going to be delivered. And was there another one, Jed?
Mayor?
Yes, are there plans to deliver goods to those infirm / those unable to get them?
Hold on.
Is there anybody who would like to take that question who's online in the panel?
Yes, ma'am. Mick Wood.
Supervisor Gleason, go ahead.
Thank you, Mayor. Several services that Kern County supports and provides services to the infirmed and people with difficulties are considered essential services. Meals on Wheels will continue to serve. The probation department will continue. The Department of Human Services is a critical service that will be provided to the public, but we will have minimal staffing. And everywhere that we serve now in terms of helping the infirmed, we will continue to provide that service. But earlier I had said something about a gentleman who asked a question about permitting, and I'm reading here that no new permitting applications except oil and gas are going to be continued during this period. Thank you, Mayor.
Okay. Callers, I'm going to see if there's any of you who are just hanging on to listen to what's being said. Please go to the YouTube website and look at it. Otherwise, we think there's 18 of you in line. If you're just listening to us, please don't occupy that space. So caller, if there's somebody there who wants to speak, please speak up and identify yourself.
Hello.
Please speak. Identify yourself, please.
Hello.
We hear you fine. Can you hear us?
Hello. Say your name, please.
Yes, I can.
Okay, go ahead.
So, hi, my name is Nicole, and I'm the owner of one of the motels. And this question is regarding the occupancy drop that we are facing at this moment, especially on behalf of like the small motel owners. Our occupancy has come down to like 10% since all the tourism is canceled. So I just wanted to plan ahead of time, thinking that a major drive we get in is contractors and construction workers. And during the last town hall meeting, I was there, and we were anticipating a lot of work that's going to come up. So with this current situation of coronavirus, what do we expect with the work going on at the China Lake base? Is it changed? Is it postponed, or is it still going to be on schedule?
Okay, one thing, the tourism has not been canceled. Let me say that with nothing, nobody has the authority to cancel tourism. But as far as addressing what's happening at the base, would one of you care to take that, please?
I'll wait now. Okay. In terms of construction on the base, it depends on the individual contractors that have those projects, and then also depends on Naval Facilities Command. So that's an ever-evolving situation, just like out in the community. Depends on different situation, different circumstances. Thanks.
Thank you, sir. Okay, is there another caller who would like to speak? Caller?
Yes, I have one. Thank you.
Please identify yourself. Caller, we hear you. Please identify yourself.
Yes, this is Chris.
Please go ahead.
As far as dental offices in town, will they be shutting down? Are they mandated to be shut down? Or is it still based on the business themselves?
Dental? You mean at the base?
No.
Here in town?
No. in town?
We've heard no direction from the feds or the state regarding any sort of dental services, so I would say you're good to go.
If there is a shortage of masks, will that be anything that further mandates the closure?
Yeah, I would say that would be your call. If there's a way that you can, acquire any of the N95 masks, if you need that for your staff or yourself, then I would say you need to take that into consideration whether or not you continue to operate.
Okay, thank you.
Thank you, caller. Next one, please. We're down to 8. Please identify yourself and speak up. Any caller? Jed, do you have any more? Okay, callers, we're out of emails, so please ask your question or we will begin to shut down. Please identify yourself.
Jimmy, citizen. I'm just wondering if this is going to affect our infrastructure, trash, water, electricity.
You've got a couple of people talking. Please, one person at a time.
Is this going to affect water, trash, electricity, our infrastructure, just basic needs?
Yes, all those needs are still up and running. I know that wastewater is up and running, fully operational. I spoke with Don Zadiba from the Indian Wells Valley Water District today. They're fully operational. They have a significant amount of cross-training and staff to be able to handle water access. I would assume that SCE and PG&E are in the same position. So right now, and the same with trash. Everything is still up and operating at this point in time.
Okay, thank you, sir. The next caller, please. I see there's 5 of you. I can hear you. Please speak up. Caller, please speak up. Can you identify yourself, please?
It's always been my dream to be a musician, and I've been fighting for it my entire life, and it's just a wonderful thing to be able to fight for it here.
Sorry, if you have a radio on, can you shut your radio off, please, because we can't hear the callers.
Caller, please identify yourself, begin to speak. Make sure you are the only one speaking. Caller, please identify yourself and address your question. Okay, let's go to the next one.
Ready? Is the fire department still going to be doing fire sprinkler inspections, and is building inspectors going to still be conducting those inspections as scheduled for now?
Mick, can you address the fire department?
Yes, that's an essential service, and there are no changes to the fire department.
What about building inspection?
Building inspections will have to be done by schedule and schedule only.
Thank you.
Okay, is there any other questions? Any other callers? I see there's only 3 of you left. Caller, one last time, please speak up. Please speak up and identify yourself.
Can you hear me?
Yes.
Yes, my name is Yvonne Rodriguez. I'm from Ridgecrest, California. I'm just curious, what time will the quarantine, Ridgecrest be going down into quarantine?
Can you repeat your question, please?
Sorry, what was that, ma'am?
Would you repeat your question, please?
What time will Ridgecrest, California be going down into quarantine?
We aren't.
We
have
haven't scheduled the time yet for quarantine.
Oh,
Quarantine.
okay, all right.
We're not even
All right.
considering that at this point in time.
Oh, okay, I was just told that.
It comes from the governor.
Oh, okay. All righty.
Okay.
Thank you.
Thank you.
Ready.
Any other callers? Okay, callers, I'm assuming if you're not speaking, you're done. Callers,
Hello,
I see
Peggy.
there's two of you. Please speak up and identify yourself.
Mayor Breeden, can you hear me?
Yes.
We hear you fine, thank you.
Okay, this is Jessica Weston from the Daily Independent. I wanted to know if the council meeting on Wednesday is going to be held as scheduled.
Yes.
Okay. So people can actually physically show up?
Yes.
Yes.
We're
Okay, thank you.
gonna do the separation where you have to be 6 feet between the people.
And we are hoping to be able to allow people to call in on the phone for public comment. Tonight was kind of a test run on how this is working, so we'll see if we can work out the bugs for Wednesday.
Okay, thank you, Jessica.
Thank you.
The last caller, please. The last caller. Okay, I see that there's no other callers to speak.
Lauren Skidmore had an update on the DMV, she said. Lauren?
Lauren, would you like to address that?
I would love to. We just got an email at 7:30 from the Department of Motor Vehicles stating that today they've asked California law enforcement to exercise discretion for 60 days in the enforcement of driver's license and vehicle registration expiration dates beginning March 16, 2020. The DMV has taken this action so the at-risk populations, including seniors and those with underlying health conditions, can avoid required visits to the DMV field office. Transactions that fall within this action include driver's license renewals for those 70 years and older who are required to take the knowledge test, individuals who are required to renew in the office, individuals subject to vision tests, and individuals with complex driving history. The 60-day period also applies to vehicle registration renewals for customers who are not eligible to use an alternative service channel because of the following reasons: smog issues, recent transfer, outdated insurance information, registration expired for 90 days or more. And all of this will also be on the Assembly members' Facebook page, and you can also find it on the DMV website.
Thank you. We appreciate that. Also, I just got a text from Shannon Grove. She's still on the floor, so she is, oh, that sounds terrible. She's still in session, and she will get back to us if she can, but she doubts that she will. Okay, I see two more callers. Is there anybody who wants to address anything before we cut it off? I hear somebody. Please speak. Caller? Caller?
Can you please turn your radio off?
Okay, we're going to cut that caller off. Was there one other caller left? Any other callers online?
Hear me?
Yes, we hear you. Please speak up and identify yourself.
Yes, ma'am. My name is Amanda Kreiner. I am a small family licensed daycare provider, and I just wanted to know how, if I need to shut down, how long I'm supposed to shut down for, and how I can get some sort of financial relief.
Dave, do you have any information on that? Dr. Ostosh says he does not know how daycare providers are being dealt with. I suggest you might call the governor's office and see if you can get any information, or the Kern County. Mick, can you address that, who you would get it from in the Kern County school? Their daycare, they're wondering what happens with them. Supervisor Gleason?
This is Lauren Skidmore.
Lauren, okay, go ahead.
Peggy, this is Lauren Skidmore with the Assembly Fong's office. We were advised today that there will be guidelines sent out. Media outlets should be picking it up sometime tomorrow on guidelines for daycare facilities and preschool providers. So hopefully more information tomorrow will come. If you do not hear anything tomorrow, I would definitely call the Kern County Superintendent of Schools for more information.
Thank you, Lauren, for that information. Okay, I see there's one new caller. Is there any, do you wish to speak, caller?
Yes, my name is Tina Francoso. I have a question for those who need transportation out of town, and is the hospital able to provide it? If diabetes, anything form of that case.
Okay, the CEO at the hospital, Jim Suver, answered the questions beforehand, so he was not able to answer this one right now. My suggestion would be to call the hospital, ask that question, and they will direct you with the answers. Thank you very much. Okay, it looks like we've gone through all the callers. So right now, I am going to, oh, you have one more, Jed?
Yes, ma'am.
Please.
Is there any specific threshold of active cases that might cause forced closures of bars, restaurants, etc., or would a directive like that only be able to come from the state level?
Does anyone have that information? I know it came from the governor.
It would come either from the Kern County Public Health Director through the state and or the nation.
So we don't have any answers for you on that, except that I'm sure we're going to be hearing more information about it because it was such a hoopla today when they mentioned that all the bars were going to be closed. So I don't want to diminish your question, but we can't answer it for you right now. Okay, I see there's one new caller. Please, this will be the last phone call. Caller, are you there? Okay, that's the last phone call. Thank you very much for all of you who called in and emailed. Jed, did you have any more?
No, ma'am.
Okay, so what we're going to do is come for the closing statements, and I'm going to ask the panel, does anybody want to say anything that you may wish to continue to address? Can we help you speak to the public again?
Mayor, this is Mick.
Mick, go ahead.
Real quick, I answered incorrectly. The question was asked earlier about permitting. I want to make sure I get it clear the air. The only permits, the new permitting that is being done is going to be for oil and gas only. And because of limited staffing, we'll be taking calls. We'll be having hearings perhaps, but no new permitting applications accepted at the present time. Thank you.
Okay. Did anybody else want to make any statements or anything? Anybody here? Okay, what I'm going to ask is that you understand we've had a little bit of difficulty with the call system. We are working on it. We plan on more of these. This is the way we can communicate, I think, best with the public, short of getting everybody in one room, and we know we can't do that. So I appreciate the phone calls. I appreciate you all working hard to try to get in. If we missed any of you, please give me a call. I'll take it. 760-382-3563 is my cell phone. And you can give us a call or text me, and we'll try to get answers for you. No other closing statements by anybody? Thank you very much. I just want us to continue to remember that we are community, C-O-M-M, capital U-N-I-T-Y, community. This is who we are. We work together. We believe in each other. We're kind to each other, and we're going to continue this. So I thank you all for your participation, and especially all of you online, and to Vince Fong's office, and Lauren, and to Shannon Grove. We thank you all. Mick, we appreciate you being online also. Thank you all, and good night.
You're the best, Mayor.
Thank you.